This is one of the oldest diabetes medicines still used today, and after more than 60 years, doctors and scientists are still finding surprising new ways this small tablet may help the human body. But what makes this story so amazing is that many newer medicines have come and gone, while this continues to stay important in hospitals and clinics around the world. Researchers have also looked at whether this medicine could help lower the risk of certain cancers. Some early observations showed that people with diabetes taking it sometimes appeared to have lower cancer rates compared with people using some other diabetes medicines. But scientists still do not have enough proof to recommend it as a cancer treatment for everyone. The story did not begin in a modern laboratory with expensive machines and computers. It actually began with a flowering plant called French lilac, also known as goat's rue, which people used hundreds of years ago in traditional remedies for symptoms linked to diabetes, such as extreme thirst and frequent urination. Scientists later discovered that this plant contained natural substances that could lower blood sugar levels. But the early versions were not always safe enough, so researchers spent years improving the formula until it finally became available as a medicine in the late 1950s in the United Kingdom. Since then, metformin has become one of the most prescribed medicines in the world, with hundreds of millions of people using it for type 2 diabetes. Doctors trusted it because it helped lower blood sugar, reduced complications linked to diabetes, and usually cost much less than many newer medicines. One reason metformin became so popular is because it usually does not cause weight gain like some older diabetes medicines. But another major advantage is that when used alone, it rarely causes dangerously low blood sugar, which can sometimes happen with other treatments. The human body needs insulin to move sugar from the blood into the cells where it can be used for energy. But in type 2 diabetes, the body slowly becomes less responsive to insulin, and this causes sugar levels in the blood to rise over time. Metformin works in several ways at the same time, which is one reason researchers still find it fascinating even after decades of use. It helps reduce the amount of sugar released by the liver, helps muscles use sugar more effectively, and also reduces how much sugar the body absorbs from food. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me, encouraged to make more videos. Scientists also discovered that metformin switches on an important energy sensor inside cells called AMPK. But instead of using complicated scientific language, you can think of AMPK like a fuel management system inside the body that helps decide how energy is used and stored. When this energy sensor is switched on, the liver makes less new sugar while muscles become better at pulling sugar out of the bloodstream. That combination helps many people keep their blood sugar levels more stable during the day. Over the years, doctors noticed something very interesting about people taking metformin. Some patients seemed to receive benefits beyond blood sugar control, and this pushed scientists to explore whether the medicine might help with other health problems too. One of the most common extra uses for metformin today is for women with polycystic ovary syndrome, often called PCOS. Many women with PCOS have insulin resistance, meaning their bodies struggle to respond properly to insulin, and this can affect hormones, weight, and menstrual cycles. High insulin levels can push the ovaries to produce more male-type hormones, which may lead to irregular periods, acne, excess hair growth, and difficulty becoming pregnant. But when metformin improves insulin sensitivity, these hormone problems can sometimes improve as well. Doctors found that some women taking metformin experienced more regular menstrual cycles and improved ovulation. That does not mean it works perfectly for every person, but it became an important option for many patients dealing with PCOS symptoms. Another area attracting huge attention is aging research. Scientists are asking a very big question. Could one old diabetes medicine possibly help people stay healthier as they grow older. Some early research has suggested that metformin may influence processes linked to aging, inflammation, and energy use inside cells. But researchers are also careful to say there is still no final proof that metformin slows aging in humans. Even so, the interest is enormous because aging itself increases the risk of many diseases, including heart disease, dementia, cancer, and diabetes. If one affordable medicine could reduce several risks at the same time, it could completely change the future of healthcare. Scientists are also exploring whether metformin may help protect the brain. Some research has suggested the medicine could possibly reduce damage linked to diseases affecting memory and brain function. But the evidence is still mixed, and researchers say much larger human trials are needed. There is growing interest in how metformin may influence inflammation inside the body. Chronic inflammation is now believed to play a role in many diseases, including heart disease, obesity, kidney disease, and even some cancers. What makes this especially interesting is that metformin is not some brand new experimental drug costing thousands of dollars per month. It is an old, low-cost medicine that has already been used safely by millions upon millions of people across the world for decades. But even medicines with long histories still come with side effects and risks. The most common problems with metformin are stomach-related symptoms such as nausea, diarrhea, bloating, stomach discomfort, and sometimes changes in taste. Many people notice these side effects most strongly during the first few weeks. Doctors often recommend taking the medicine with food or slowly increasing the dose over time, because that may help reduce stomach irritation. There are also slow-release versions of metformin that release the medicine more gradually into the body. Some patients who cannot tolerate the regular version feel much better after switching to the slow-release form. One lesser-known issue linked to metformin is vitamin B12 deficiency. Research has repeatedly shown that long-term metformin use can reduce how well the body absorbs vitamin B12 from food. Vitamin B12 is important for healthy nerves and healthy blood cells, but when levels become too low, people may experience tiredness, numbness, tingling in the hands and feet, balance problems, or anemia. This point is especially important for people who already have diabetic nerve damage, because low vitamin B12 can sometimes make nerve symptoms even worse. That is why many doctors now recommend regular B12 testing for people taking metformin long-term. There is also a very rare but serious condition called lactic acidosis linked to metformin. This happens when lactic acid builds up in the blood faster than the body can remove it, and it can become dangerous if not treated quickly. Thankfully, this complication is rare, especially when metformin is used correctly. But the risk becomes higher in people with severe kidney disease, severe liver disease, or serious illness affecting oxygen levels in the body. That is why doctors often monitor kidney function regularly in people taking metformin. Sometimes patients may also be asked to temporarily stop the medicine before certain scans, surgeries, or during severe infections. For many years, the medical advice for type 2 diabetes was simple: start with metformin first. But diabetes treatment is now changing as newer medicines become available that may also protect the heart and kidneys. In 2026, the National Institute for Health and Care Excellence, often called NICE, updated its diabetes guidelines. The new recommendations suggested many patients should receive medicines called SGLT2 inhibitors alongside metformin from the beginning of treatment. These newer medicines help the kidneys remove extra sugar through urine, and research has shown they may also lower the risk of heart failure and kidney damage in some people with diabetes. But even with these modern advances, metformin still remains a foundation treatment for millions of patients worldwide. Doctors continue to trust it because it is affordable, effective, and supported by decades of real-world experience. There is something almost remarkable about how one medicine can survive generation after generation of medical change. Many drugs disappear after a few years, but metformin keeps finding new roles in modern medicine. Scientists are now even exploring how metformin may influence the gut microbiome, which refers to the trillions of bacteria living inside the digestive system. Research suggests these gut bacteria may influence blood sugar, inflammation, immunity, and body weight. Some newer research even suggests metformin may partly work through signals involving the brain, not just the liver and muscles, as scientists originally believed for decades. But researchers are still working to fully understand these pathways. This shows something very important about medicine and science. Sometimes researchers believe they fully understand how a drug works, only to discover decades later that there are still hidden effects nobody noticed before. The story of metformin also reminds us that older medicines should not be ignored just because they are old. Some of the most valuable treatments in healthcare today are medicines that have survived because they consistently helped patients year after year. Drug development is extremely expensive, and creating a completely new medicine can take more than 10 years and cost billions of dollars. But finding new uses for older medicines may sometimes save enormous amounts of time and money. Researchers around the world continue searching for new ways older medicines may help with diseases that currently have limited treatment options. That approach is becoming increasingly important as healthcare systems struggle with rising costs and aging populations. Metformin may never become a miracle cure for aging or every disease scientists are exploring. But its long journey from a simple plant remedy to one of the world's most trusted medicines is already one of the most fascinating stories in modern healthcare. After more than 6 decades, this small tablet still continues surprising researchers, doctors, and patients around the world. And that is something very few medicines in history have managed to achieve. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me encouraged to make more videos.